Hello, I'm Dr. Annette Zaharoff. I'm the director for the Non-Surgical Center of Texas. I'd like to talk to you about stem cell therapy today and how it's used in the orthopedic field. There are many things that we have that are injuries that will not heal. And constantly our body's repairing every day, every hour, cells in our body that get damaged. And how do we do that? We do it because we have stem cells that are constantly regenerating new tissue in our body. So we can take that same concept and apply it to orthopedic injuries. Injuries that aren't healing in our body, we can actually use our own body's stem cells from our adult tissue to help repair those injuries. The good news is that this tissue can come from our fatty tissue. The fat tissue has the most abundant supply of stem cells in the entire body. So it's a wonderful source to help regenerate injuries. So a simple procedure is doing a little mini liposuction to harvest that fat tissue, a very minimal manipulation to take that tissue and actually isolate out the stem cells that are going to help your body repair an injury. And then we simply take that tissue and inject it back to the injury site. The body then stimulates its own natural repair process. So without surgery, without extensive other treatments that might be more invasive, you can actually take tissue from your own body and inject into an area and get a healing response. It's your own tissue, so there's no problems in terms of any type of infection, any type of cross reactions or allergic reactions that you need to be concerned with. It's a very safe procedure. There's no controversy in terms of any type of embryonic stem cell. You take your adult stem cells and re-inject them into that area that's injured and help repair. So you actually stimulate a long-term response as opposed to a temporary fix for an injury. It can be used for all types of injuries. Areas where we have degenerated hip problems, osteoarthritis of the knee, foot problems, shoulder problems, elbow pain. Stem cells can be very useful to help that body heal. One of the things to take a look at is someone who has experience in doing that type of procedure. I've been doing regenerative injections for 10 years. I have thousands and thousands of cases that I've used regenerative injection therapy for and very successful outcomes. In fact, there's the highest level of evidence in research that demonstrates these treatments work, and they've been used decades in different areas of medicine. In dental therapies, they've been used in orthopedics for different types of surgical procedures, for fusions, but these are something that we can use ahead of surgeries. We can get ahead of that curve and prevent surgeries from occurring. If you have an area that's not healing, consider therapies like stem cell therapy. It's safe, effective, and a little fat removal never hurt anyone.